ma'am.
Thank you. Thank you so much, Dr. Bakshi, for this opportunity. I should have written to you, but I do want to say I'm not a doctor. I could be counted as a quack. Allow me to comment overall on it's not just the maternal health and the family planning and child health budget, but on the whole, I will say that I continue to be disappointed that India's health expenditure, which was mentioned earlier, is less than 1.5, it's close to 1.3. And in the presentation that was made, there is a hope based on the family health policy that India will reach 2.5, but that's a dream we've been living in the previous government and the current government. So I want to say that overall, if you don't invest in health and the budget does not increase substantially, we will have only incremental growths, incremental investments in health. While the numbers increase everywhere, we don't factor that in. We neither factor in the inflation. So the budgets are overall inadequate. But as far as maternal health, women's health, and maternal health is concerned, 50%, as we know, of India's population is in the reproductive age group, and every fifth person is an adolescent between the age 10 and 19, as per the census 2011. This makes it important, very important, to invest in maternal and reproductive health, to harness also the demographic as well as gender dividends. So while India has made significant progress in maternal mortality, which has declined from 130 per 100,000 live births to in 2014-16 to 97 in 2018-20. Infant mortality from 40 per 1,000 people live births in 2013, we have come down to 28. Access to maternal and reproductive health services remain uneven. It depends on where you live, which income quintile you're in, and definitely tribals and tribal women and scheduled castes, scheduled tribes still are at a disadvantage, and they continue to be at a disadvantage. And nearly 57% in a country where 57% of women aged 15 to 49 are anemic, and 24 million, which is 9.4 currently married women in this age group, have an unmet need for family planning, as per the National Family Health Survey 5. And despite these challenges, budgetary allocations for maternal and reproductive health remain woefully inadequate. The NHM budget has increased by only 3.4%, which is 36 crores. From 36 crores, it's gone to 37.2 crores. Family planning under NHM increased by 7.7%, but family welfare schemes under central expenditure saw a negligible 0.2% rise, which is 619 crores to 620 crores. Given the recent introduction of, also if you look at new contraceptives that the government has introduced, and happily so, after 30 years we introduced new contraceptives, but if you look at injectables and implants, they've only been introduced in 10 states because we don't have the funding. The limited budget makes the nationwide expansion extremely challenging. You know, when you have a 10% unmet need for family planning in terms of numbers, it is huge for India. And to bring in a child who the parents can't feed, who the parents can't educate, the parents can't, get healthcare, proper healthcare, it is an absolutely unacceptable and shameful situation. And as far as family planning is concerned, the budget makes broad commitments to health infrastructure and expanding medical seats, which was talked about very, very ably by Dr. Utlap. And so the budget commitments to health infrastructure and expanding medical seats, but it lacks a vision for integrating family planning and reproductive health care into a universal coverage, health coverage. With NHM seeing only 3.4% increase, the scale of demand is not met, especially considering India's vast population at a reproductive age. India's population may be declining, but we're going to continue to grow. A comprehensive health system must embed reproductive health as a fundamental pillar, rather than treating it as a standalone issue, which we are also raising in other areas, including was very aptly raised on cancer. We can't have these standalone programs where a comprehensive health system is what we need without targeted investment. India's UHC aspirations will remain incomplete. And as far as maternal health and child health, as well as family planning goes, it is the major backbone of our primary health care. And we with women having 60% of the women having anemia, being anemic, and especially those at a reproductive age, India can save a lot of money by investing in family planning. It can meet reach the unmet need. And I am absolutely surprised, given the demographic data we have for India. We are focusing on the wrong things. We keep focusing on which religious community has more people. Instead, we should be focusing on where women need attention, where women need family planning services, where if we want to be a Viksit Bharat, we first have to invest in the health of our young people, our women. And the reason we need to invest is also, and has an economic rationale. We keep talking about investing in, the budget 2025 rightly continues investments in economic growth, which must be complemented. But there needs to be a parallel focus on human development, ensuring that a skilled, healthy, and productive workforce supports India's vision for a Viksit Bharat in 1947. Without adequate investments in maternal child health, sexual reproductive health, and the elderly care, the issue of elderly came up. We are going to, by 2060, 20% of our population is going to be an aging population. India risks missing the opportunity to fully leverage the demographic dividend if we do not invest in their health well-being. Thank you.
Thank you so much.